I'm Arnold J. Friedman. I am the Director of Gynecology and Urogynecology in the Department of Obstetrics and Gynecology at Maimonides Medical Center. I'm also the Vice Chairman for Academic Affairs in that department. I have been involved in obstetrics and gynecology since immediately after my medical school training. What happened is I found that in the third year of medical school, of all the specialties I rotated through, this was the one that I liked the best. I liked the fact that the patients are generally healthy and that you see results when you work with someone who's got a medical problem in this field. And you also have the ability to care for people as individuals and families for many years throughout their reproductive health and then into the later years of their lives. We use pretty sophisticated electronic software in a very simple appearing system to measure certain pressures in the bladder and the urethra in the urinary tract that very easily gives us an answer as to what the cause of the problem is most of the time. In addition, we use electronic feedback to give patients biofeedback. In other words, to help them guide themselves toward using the right muscles, exercising the right muscles, with feedback that tells them they're doing it right. Of course, they still have to go home and do the work themselves, but at least it helps them be efficient in doing the exercises that they need to do. I think one of the things I like the best is caring for older women now. As I've gotten a little older, my patients have gotten older, and I can communicate with them. I really enjoy talking to people and hearing their stories and being able to hear a story, hear a problem, and then do something often very simple to make things better is a great delight. I mean, one of my greatest pleasures is having a patient follow a therapy, go home, do what she has to do, and come back a few weeks later telling me things are so much better. It's just a delight for me.